All right, good morning, everybody. My name is Mary Leonard. I am the chair of the Department of Pediatrics and have the great privilege of serving as the director of the Maternal and Child Health Research Institute, and it is my great pleasure to welcome everyone here this morning. This is our 7th annual symposium, and as you will see, each year we pick a hard topic, and today's agenda is quite extraordinary. The intersection of big data, trust in science, communication, and couldn't be more timely and more important, and we're really delighted to be here today and to welcome the incredible lineup of speakers, both folks from Stanford and from outside Stanford. For folks that don't know about MCHRI, we were founded in 2010. We are the 5th institute in the School of Medicine, and we have created a community across this entire university that's dedicated to advancing the health of mothers and children. We now have 1,300 members, which is extraordinary, and they represent every single clinical department, basic science department, and school on this campus. We have a wonderful annual data report, and you can go online. The 2024 one was just posted, and you can learn more about the Institute. Everything that we do and everything that you're going to hear about and all the programs offered by MCHRI are funded through very generous support from the Children's Hospital as well as from the Lucille Packard Foundation for Child Health. The foundation has raised endowments that are the underpinnings of some of our most important funding mechanisms. But the other thing is if you go online and you donate to the Children's Hospital and just through the Children's Fund, a third of those dollars come to the Research Institute. So, you know, another evidence of the commitment from the hospital and the foundation for everything that we do. We have 3 pillars. The first is the grant funding. Over the last year, we awarded 168 peer-reviewed grants totaling $11 million. We have seed grants, pilot grants. We do postdoc funding. We think we are the single biggest funder of postdocs on this campus. We made the decision early on that putting postdocs into the labs around this campus, especially labs that maybe aren't thinking about maternal and child health, and getting them to think about maternal and child health could be a really powerful lever. We have transdisciplinary grants that require a very meaningful collaboration with an investigator from another school on this campus. Those are really fun. I encourage you to look online about more about those. And then we have very purposeful partnership grants, whether it's the Center for Innovation in Global Health or the Diabetes Research Center or SPARC, where we want to make sure that all those other programs are thinking about mothers and children. And then finally, more recently, we have really invested in community-engaged research grants, which has been a new priority for us. And again, that's specifically funded through the Children's Fund. And then we have not only given out that many grants, you can imagine how much work that is. We have 13 different study sections, and we have 107 faculty who have served on those study sections. So thank you to those of you who have done that, and anyone who's been funded by MCHRI, we hope we can call on you to serve on those study sections in the future. The next thing we do is we've made a huge investment in recent years on infrastructure. We've had a wonderful partnership with the QSU, so if you're a maternal and child health investigator, you can access some of their biostatistics and data management services through our website. And then the Clinical Research Support Office. I hope people are aware of this. This office has been incredibly impactful. If you need to navigate the Children's Hospital to do research, you need custom EPIC order sets, the investigational drug pharmacy, radiology, pathology. There's portals. There's a real huge help navigating that. So please take advantage of that. It is run beautifully by Carl Sylvester as the faculty director and Allison Falwell. And I think part of the reason that office has been very, very impactful and successful is because the hospital executives, Rick Mason, the chief operating officer, the chief nursing officer, the chief information officer, all serve on that exec. And that is what has removed so much of the friction when we're trying to do research in the hospital. We are now very much trying to help the entire hospital, all the staff, everyone understand that we do research every day in the hospital. It's not just something that happens over in the School of Medicine. So we had a community event in June, standing room only, over 300 people from the hospital and from the school coming together to talk about this work. And we are doing this again on December 12th. So there will be slides about that, I'm sure, over the course of the day. The clinical informatics support team, thank you to Natalie Pagler and C. Joe Thomas, fielded over 500 requests, and our clinical research coordinators support over 200 studies. The newer Office of Community Engaged Research, beautifully run by Anisha Patel and Dong Mei Tan, provided us technical support to over 50 projects last year. I think we're just getting incredible momentum out in the community. And then last, in terms of infrastructure, I hope you all know we are now members of PedsNet, and apropos today's conversation in big data, this is a combination of the electronic medical record across 12 children's hospitals that now includes 13 million patients, or 10% of the nation's children, and that's run beautifully by Adam Schroeder, who's the PI. The next pillar is education. That is really what's happening here today. This symposium is the work of the Education Committee, but they do so much more. They put on a beautiful monthly symposium. Please go online. They're recorded. It's an incredible repository, whether you want to learn more about drug discovery, innovative models for community-engaged research, qualitative research methods. That one had a huge turnout. Implementation science. We fund any of the biodesign faculty fellows that are doing work in maternal and child health. We fund fellows who want to get master's degrees. But really, the crown jewel of the work of the Education Committee is this symposium. We had well over 400 people registered. We had nearly 200 abstract submissions. That was a new record for us. And half of the ones that were submitted by trainees, and that's really what we want to see here. The abstracts represent 26 different departments. That is very much what the Institute is looking to accomplish, and multiple schools. So I want to thank all the people who served as abstract reviewers. But most importantly, I want to thank the Education Committee that is so beautifully chaired by Tony Oro. This program today is extraordinary when you look at the intersection of all the different related topics. We had our speakers at a dinner last night with Dean Miner and other members of our community it was a really invigorating conversation about how MCHRI can advance the field. But so a shout out to the committee members, Tony Oro, who will be up in a moment, who chairs the committee. It's really been his vision from the beginning. Christine Ticey from genetics, Danny Chow from pediatric endocrinology, Kara Meister from otolaryngology, head and neck surgery, Kelly Mahaney from neurosurgery, Nima Agapur from anesthesiology, and Sushma Reddy from pediatrics. So can we just give a round of applause to the Education Committee? And then this whole program has been put together so seamlessly, and I know it will go seamlessly, as did the dinner last night, and to that we owed a debt of thanks to Mary Chen, and then Netta Miller, Harmon Gill, and all the volunteers who are here today. So thank you to everybody, and we're looking forward to a really fun day. Tony, the floor. Oh, I'll just say one last thing on the topic. You know, when I was president of the American Pediatric Society, as we were just coming out of the pandemic, we had to pick an issue of the year. And we picked our issue was going to be leading with science and integrity, the role of pediatricians in demonstrating trustworthiness. And that really the underpinnings of that was data from the Kaiser Foundation, Family Foundation, that the public of all the different places where people get their information, media, politics, from everywhere, the people that the public trusts the most are the pediatricians. So that's why this is a special mandate for us today. Thank you.
Thanks very much, Mary. And I'm Tony Oro from dermatology, and I really want to thank the Education Committee again for this concept and also for the day's planning. I think it's, as you'll see, invigorating, and I just want to give you a little bit of an overview about what's going to come up. So I just want to go back to the first slide. Great. So the question is, why do we care about information? And so I'm trying to kind of set the stage. This is what it was like many years ago in an information poor area where the eye perceives edges, green versus white. We know truth versus not truth. And if you don't have many different information, you can easily tell green from white. However, in this information explosion, which we have now, you're starting to get harder and harder to tell truth from non-truth, information from disinformation. And now, in our absolute explosion of information, it's really hard to tell. How do you know what's real, what's not real? What information is trusted, not trusted? And so how do we then put it all together, and how do we communicate what's real and what's not real into actionable items? That's really what we want to focus on today. So hopefully, put your thinking caps on, discussion, ask questions, think about how do we tell what's real and not real? And that's the speaker lineup today will really help set the stage. As we learned last night, there's no real answers. We have to be humble about our assessment of what we think is right and not right, but come into a learning community. And one of the speakers today, Kristen Beam from Harvard, has a paper, which I think is really awesome. It's the reference is there. And really, it's this iterative learning community, which is data collection, processing, data analysis together, and then basically quality challenges. How do we know what's real and not real? Put it into practice. And then how do we communicate on the right and evaluate, validate, implement it so that we have actionable, trustworthy information for our patients and our communities? And then not just once, but iterate it until we get it again and again. That's really what we're going to talk about today. And so the sessions are, number one, about accumulating the data, how to analyze it. Number two, Dean Miner will then moderate a session on translating and basically evaluating and risk and benefits of implementation. Session 3 is our groundbreaking research from scientists. And then 4 really is going to be a highlight, which is how do we message it to the community. And I urge you to stay into the last session because this is going to be amazing in terms of real-life implementation of data science. At lunch, we have the posters. And then also, right after lunch, Mary will basically present our Visionary Leadership Award annually to an outstanding member of the community, and today will be David Stevenson. So with that, I'll turn it over to session 1, education member and talented professor, Nima Margapur. Thanks.